Hello guys, in this video we are going to study about G6PD deficiency, a topic from pathology. It is a very important topic that you need to know. Although questions are asked on the basis of only factual questions are asked in NEETPG and INICET examination, but still I am going to make you understand that how and actually why G6PD deficiency causes or leads to anemia, right? So I will start with a basic concept over here and we will do a reverse engineering of this topic. We all know that in RBCs, hemoglobin is present. Now, we take out that hemoglobin. Hemoglobin is a protein molecule and proteins are composed of amino acid. Now, there are amino acid which contains SH group, right? There are amino acids that contain SH group. This is hemoglobin molecule, right? It is protein and they are composed of amino acids. Now, there are few amino acids that contain SH group. Now, these SH group are very actually important to understand why actually G6PD deficiency leads to anemia, right? So I have made two different hemoglobin molecules, right? And each of them contain SH group, a lot of SH groups. Now what actually happens that these two SH groups can react to form one molecule. How? You can easily understand by this, right? If I remove the H, both the H molecules, and I make a bond between them, then this particular whole molecule becomes a single molecule, right? Single molecule, that is two hemoglobin molecule combined together. And when two hemoglobin molecules are combined together, then what happens? It clumps, right? It clumps, and these clumps can be seen in the peripheral blood smear as hinge bodies or Heinz bodies. Okay, so this is the basic thing I wanted you to know. Now the question is that why will a hemoglobin molecule will remove its H group from the H hydrogen atom from the SH group, and another molecule will do the same to form a bond between them? The answer is this happens because of reactive oxygen species. Reactive oxygen species. The answer is reactive oxygen species, just like H2O2. So H2O2 is the main culprit, right? We all know that H2O2 is an oxidizing agent, right? So what it will do, H2O2 will take the H group of the SH and another H group from the another SH of hemoglobin, and it will form water, just as we can see over here in this picture, right? Right, this will happen, and it will take the two H groups, and after the H groups are removed, the 2S or the sulfur molecule will come together to form a complete whole uh, hemoglobin molecule to form clumps and hinge bodies, right? So this is the main pathology that occurs over here. Now our question is that what can we do so that H2O2 doesn't react, or H2O2 doesn't react to these SH groups? What can we do, right? So the basic main thing that is that we need another reducing agent, so that H2O2 doesn't reduce the hemoglobin molecule, doesn't oxidize the hemoglobin molecule, but it oxidizes something else, right? So what is that molecule? It is 2GSH. 2GSH is a molecule. 2GSH is a molecule that it is a reduced molecule, and it reacts with H2O2 to form H2O, and it itself becomes 2GSSG, which is an oxidized form, right? So these hydrogen molecules actually have come over here, right? So there is an enzyme over here present. The name of the enzyme is glutathione peroxidase. The enzyme doing this process is glutathione peroxidase. What is glutathione peroxidase doing? It is converting H2O2 to 2H2O. In this process, two H atoms are added to H2O2, and from where these two H atoms are coming? It is coming from here, 2GSH, right? And in this process, 2GSH is converted to 2GSSG, which is an oxidized form. Now, of course, we don't have abundant amount of 2GSH, so we have to replenish these GSSG molecules to form 2GSH again, right? And who will do this stuff? This is done by NADPH molecule, right? NADPH molecule, you can see over here, NADPH molecule has an H, right? So this particular H will come over here, and hence it will be replenished, right? So this particular reaction is actually done by another enzyme called glutathione reductase, right? Glutathione reductase. These molecules that we are seeing are actually glutathione, these 2GSH and GSSG, right? So now we have converted NADPH to NADP positive. Why? So that we can get reduced glutathione, right? So now NADP positive will again be required to become NADPH, right? So in this process, glucose 6-phosphate is the molecule that converts to 6-phosphogluconolactone, right? So glucose 6-phosphate converts to 6-phosphogluconolactone, so that NADP positive can become NADPH, right? So again an enzyme comes over here which is called glucose 6 phosphatase. Glucose 6-phosphatase is the enzyme that comes over here, right? And this particular enzyme is no one but G6P, right? Glucose 6-phosphatase, and the deficiency of this particular enzyme is called G6PD deficiency, right? Very easy. So what will happen if G6PD deficiency is present? What will happen if G6PD deficiency is present? If G6P deficiency, glucose 6-phosphate deficiency is present, then glucose 6-phosphate will be not be converted to 6-phosphogluconolactone. In the same process, NADP positive will not be converted to NADPH. If there is no NADPH, then who will give the hydrogen atom to GSHD so that it can be reduced? So GSH will not be present. If GSH is not present, then GSHH will not be added to H2O2, and this particular reaction H2O2 to water molecule will not be formed, right? So what will happen if this particular reaction doesn't occur? H2O2 will rise in concentration. H2O2 will rise in concentration. And what happens if H2O2 rise in concentration? We already know, right? It will take away the HH molecules from the hemoglobin SH groups, and it will clump together. And what happens when we clump together? It forms hinge bodies, right? So now we are coming to the histopathological, peripheral blood smear of a G6PD deficiency patient. Here you can see these are molecules, these are hinge bodies. You can see over here. Then again you can see over here, these are nothing but hinge bodies. And what are hinge bodies? These are clumped hemoglobin molecules together. And why have they clumped? Because of reactive oxygen species. Now when these hinge bodies actually go near a macrophage, these RBCs containing hinge bodies go near a macrophage, the macrophage tries to cut them off, right? The macrophage tries to cut them off. So the macrophage takes a bite of these hinge bodies, and in the process of taking a bite from the hinge bodies, it also takes a bite from the RBC. So the RBC looks like this. This particular image, you can see the RBC looks like this. So it is called bite cells. Bite cells are characteristics of G6PD deficiency. Extremely important. You cannot afford to forget it. Bite cells, G6PD. Hinge bodies, G6PD. Right. Now coming to the next thing. What is the inheritance pattern? Right. We have come to the rote learning part of this particular topic. The inheritance pattern is X-linked recessive. Right. G6PD deficiency is the most common enzymatic disorder of RBCs. Okay. Now, what type of hemolysis does it do? Okay. It does extravascular plus intravascular hemolysis both. What is the clinical feature of this particular what is the clinical feature of G6PD deficiency? The clinical feature are back pain, hemoglobinuria, few days after taking oxidant stress drugs, right? There are few drugs that produce oxidative stress in your body, and when these drugs are taken, it causes, after a few days, it causes back pain and hemoglobinuria. These two are clinical features, right? So very important, what are those drugs? First of all, sulfa drugs. Second, fava beans. Third, anti-malarial drugs. Fourth, infections. And there are few more drugs that you actually need to remember. Isoniazid. Sixth, dapsone, very important. Seventh, primaquine. Eighth, aspirin. 9, ibuprofen. And 10th, nitrofurantoin. It is a drug which is used in UTI also. So of course not all the drugs are important, but still you have to remember sulfa drugs, fava beans, antimalarial drugs, dapsone, primaquine. If you cannot remember all of them, at least remember these 5. These 5 are very important, right? So that's it guys. Everything important about this topic I have told you, and I have also told about also discussed about the concept behind this particular disease. Thank you.